why don't you tell us a little bit more about the bonding? Like you etch, then you rinse, then you dry, then you prime. Like tell us that step maybe.
Sure.
Let's say they actually got it from Specialty Appliances or TP Orthodontics or the orthodontic lab. What do they do once they get that tray in?
Sure. So the patient, like just like normal bonding procedure, a patient would come and sit in your chair. I like to use a NOLA retractor, the NOLA cheek retractor, and we'll post links later on your website in this chat feature as well, where you can purchase some of these things. Use a NOLA retractor for great isolation, the adult or the child version. The adult is clear or white and the child's red. I use dry angles as well, just to keep the buccals segments nice and dry, block the parotid gland, I mean. And then etch, there's different versions. Some people use the blue etch and some people use the green, more viscous etch. And we'll go over that obviously in more details like you never want to know. Etch and then prime, you can either use the Assure Plus, which I use actually in my office for everything. Some people just use Assure, but I use Assure Plus for all the teeth because it helps for people who have buccal restorations, buccal amalgams. This kind of does everything one solution in a way. And then after the etch is on, then you would light cure the primer, and then you would, on the back of it, you would put just a bead of flowable composite. It's not any composite. We'll go over the details of which composite I recommend using. Flowable composite on the back of the bracket pads. So that way it forms a custom bracket pad for each contour of the tooth. So there's no void in terms of the curvature of the tooth. You're actually making a custom bracket base for every patient, for every tooth. After that's on, you would have your assistant, and this is all delegated to the assistant. The assistant would transfer all the brackets to the patient's mouth with the whole tray, both trays at the same time, and then they would light cure. They'll quickly light cure all the way around, and then they would individually light cure 30 seconds, or it depends on your curing light. And we can test your curing light to see the recommended time of every tooth. Once they cure every tooth, then they use a scaler and they peel off the first layer. They peel off the outer harder layer of your tray. The next layer is on there, and they gently remove it from lingual to palatal, lingual to buccal, slowly peel off the second layer of the plastic, kind of like the whitening tray material layer, and then all the brackets are on.